our next guest, has been pointing out some of the problems that the hospitals are up against right now. Dr. Jenny Vaughan is the Vice Chair of UK Doctors Association. She joins us live now from London. So, Dr. Vaughan, thank you so much for being with us. So, given the new sort of transmissible strain of this virus, given the rising number of cases, what does the month of January look like for hospitals there in the UK?
Well, as you pointed out, our cases have been rising exponentially, and we are swamped already. January is looking very worrying because we are yet to see the effects of Christmas. It's going to take 10 days from Christmas, so we think there will be a further spike round about the 11th or 12th of January. And so many of our hospitals are, wall to wall with COVID patients, patients suffering from COVID-19 in tragic circumstances. And we're appealing to the public, basically in the United Kingdom, to obey what's going on. They must obey the social distancing. They must wear a mask. They must wash their hands, because although we absolutely agree with you that this, Dr. Fauci pointed out over in the US, this new transmissible strain, it is definitely more transmissible, but our understanding is it's not more serious. And yet we have more cases, and what we're doing isn't working. And that's why they had to introduce the Tier 4 lockdown. We've got ambulances parked outside hospitals in southern England and basically treating patients in ambulances. Now, the NHS is doing its absolute best to treat these patients. We really are. Staff are stepping up to the mark. We are going to be there for patients, but everybody is under such a strain, and the situation is dire.
The one glimmer of hope, light at the end of the tunnel, if you will, is, of course, the vaccine. However, I just want to get, as a doctor, I just want to get your take on what you make of the fact that the government is now deciding to just give as many people as possible the first dose of the vaccine and then sort of wait a longer period before giving them the second dose, even though Pfizer has come out and said, we have no evidence. We have no evidence that this method actually works. What do you make of that?
Well, on the one hand, it's important to note that this is official advice. It's come out and backed by our national medical officers and the National Vaccine Committee. And what they've looked at is they've seen that if after one dose of vaccine, obviously that's offering some protection, but it's also reducing the severity of the illness. So they are arguing that actually having the first dose would mean that would relieve the pressure on the NHS, and that if you get COVID-19, you are less likely to need a hospital bed. And at the end of the day, if you've got it and you need a hospital bed, that's what the NHS is trying to step up to doing at the moment. On the other hand, people who've had the first dose of the vaccine, and I am one of them, are saying, well, I'm very worried. This is only going to possibly give me 50% protection. We just don't know, as Pfizer have said. I've now got to wait quite another few weeks before I get my next dose of the vaccine. In the meantime, I could develop COVID-19 and I am not protected. And people have also consented to have further doses. GPs have only been given 2 days' notice of this decision. They've had to cancel vast numbers of patients and then book other patients in. And you have to remember that a lot of these patients are over 80. They've made special arrangements to try and actually get their second dose of the vaccine. So there are the two sides there arguing, which way they should go. And I think the answer is a very difficult one. If you're arguing it when you're looking at it from a national point of view, you do want to get as many of your population covered with that first dose as you can. From an individual point of view, if you've had a dose and you want to be protected and get maximum protected so you don't get COVID-19, you would want your second dose. So there are those two things going on at the moment, and things are very, very tough.
You know what, you're right. It is such a difficult line to walk. I mean, obviously, I understand why people definitely want their second dose if they've had their first dose, especially if the company that's provided the vaccines have come out and said, listen, we don't even know if this new method the UK is trying is going to work. But on the other hand, as you've just pointed out, the UK hospitals, they're under so much strain, they have to do something. But in the meantime, I do want to ask you, Dr. Vaughan, how has COVID really affected, especially this new strain, and you talked about just 10 days after Christmas, we might see an even bigger spike. How has that affected people who have illnesses that are not COVID related, people who have underlying conditions, diabetes, cancer, that sort of thing, and them being able to get the care that they need as well at a time like this?
Well, one thing the NHS always tries to do is to be there for people in their moment of need, but this is its darkest hour, and we are, we have never ever faced such a challenge. And the NHS is on a war footing against this virus, as indeed I know you are in the US. People with those conditions who have have emergency conditions and need emergency treatment, we're saying to them, please come in. You must come into hospitals to get the treatment you need. But the reality is that most of our beds in the health service at the moment are full of patients suffering from the effects of the COVID-19 virus. So the staff are fighting a battle to try and make sure that all patients get the care they need. We're really emphasising to people not to go out partying on New Year's Eve and to behave responsibly, because they could be the next person in that bed. And we're worried that there's a disconnect, a big disconnect, between how people are behaving outside and what's going on in our hospitals. And my husband also works as a frontline surgeon, and the things that he's been seeing this week, he's had to call the elective surgery, so the routine surgery has been cancelled, and even emergency surgery is under pressure. It's taking place, but everything is under pressure because of the sheer numbers of patients with this virus who are coming into hospital and needing care. And although we've got a lot better at treating the virus since the first wave, that has actually meant that patients are staying in hospital for longer, oxygen supplies are under more pressure, and our intensive care beds are under more pressure. And because of that, patients are having to travel, especially in London and the South East, sometimes hundreds of miles to get, to be moved around the country to have another ICU bed. We are managing to cope with whoever needs ICU beds at the moment. We're managing to find them beds. But we are all worried about if people don't change the behaviour and cases don't start going down soon, how will we cope in January? And these are the fears of the staff on the front line.
Well, let's hope and pray that things really turn a corner in the new year. And Dr. Vaughan, I wish you a very healthy, safe, most importantly,
I think we all need that. The whole world needs that.
The whole world. A hopeful
needs a
2021.
Healthy, yeah, we really do. Thank you for having me on the programme.
Of course. I mean, I'm from the UK. England is really going through it. So my thoughts are with everyone there. All right, Dr. Vaughan, thank you so much.